The senior products will be available later in this quarter. All right, so one of the things that you have on this page is what resources do you have available? So you can see what's going on with your policies. If you send out an application to a client and the client has not signed the application, you can come in here and see pending client signature. You can encourage the client to sign the application so they can complete the application. Now, with Allstate Health Solutions, we don't have to wait till the first of the month to have an effective date. We can do a next day effective date as long as the client signs the policy today. The policy can go in force tomorrow. And it's a key point. You do an effective date of tomorrow, the client must sign today in order for that to happen. So I'm going to do a tomorrow effective date. And I'm going to do a zip code in Florida. I'm going to do an average date of birth. Now, if you have a significant other, spouse or domestic partner, and dependents, you can select here. Dependents are anyone that is under 26 years of age, spouse, husband, wife, domestic partner, what it might be. When you hit quote now, in that next page, you would put in the gender of the spouse, the date of birth of the spouse, and the same information for the dependent. For this example, I'm simply going to do one person just to keep it simple. And I'm going to hit quote now. A couple of items that you have available. Everything you see here on the left side of the screen are the products that are available for this person. An effective date of tomorrow in this zip code for a person that's 25 years old, which is what I'm quoting here. If you have multiple people in this quote, you have a family, 4 or 5 people, you would see an individual box for each, so you can see all the members of that family that you're quoting for this product. Short-term medical being the first product that's available. Short-term medical are the medical plans that are available outside of Obamacare and outside of a group environment. Short-term medical is facing some changes coming September 1st. It is important that we understand what is happening in this segment of the market. When Obamacare came out years ago, these plans were called short-term medical. At that time, you could write the plans for 3 months at a time. And we had a plan at that time where one application would rewrite itself and the client would have 12 months of coverage. With the past administration in the White House, they said every state should decide what to do. There is a handful of states that currently today, you can still write these plans for up to 36 months of coverage. It is important to understand that at the end of August, that is the last day that you'll be able to write these plans for up to 36 months of coverage. Come September 1st, based on regulations out of the White House, these plans will go to a 90-day cycle with a 1-month extension. So 3 months plus 1 month, total of 4 months of coverage. That is the maximum length that you will be able to write these short-term medical plans after September 1st. And the client can only be with the carrier one time in a rolling 12-month cycle. So that means that if after September 1st, but at the end of August, you can still write these plans for 36 months of coverage. After September 1st, you enroll a client, you're going to do 3 months plus a 1-month extension, a 4-month cycle. When that client policy terms out in that 4-month period, you will need to take them to another carrier for another 4 months. When those 4 months, now the second 4 months of that client ends, you'll have to take that client to a third carrier that does short-term medical before you can bring them back to Allstate. So there's some things going on in the market and want to make sure that you're familiar and clear on what's happening there. Today, it's business as normal through the end of August. A couple of questions that we ask on a short-term medical policy is the client using nicotine, tobacco in any way, shape, or form? If they are, there's typical rate increase of 10 to 20% depending on the gender and the age. And we ask a question, has the client had major medical? I'm not worried about it with who. We just want to know if they've had any type of medical coverage 9 months out of the last 12. If they have, we'll issue a discount on that policy. And then height to weight, we're not worried about the height, we're worried about the weight. Male to weigh 300 pounds or less, female 250 or less. And if we're rewriting the policy, say no. Now from here, on a short-term medical, I can look at the standard rates or I can ask additional questions to see a preferred premium. Additional questions are, does the client own or lease a motorcycle for high-risk items? Has the client had any DWIs, moving violations? Let's say no. The last question is one that sometimes could trick us a little bit here. This question says, in the last 5 years, has the applicant taken high blood pressure, high cholesterol, anxiety, or depression medication? This is not a knockout question. If the client is taking one of these medications, and in the US, high probability that someone is taking blood pressure during COVID, the highest prescription increase was on anxiety or depression medication. There's probability your client is taking one of these prescriptions. If they are, and you answer yes, it does not disqualify them. What it does is it takes them out of the preferred premium and it goes back to the standard policy. So here we're asking questions looking for a preferred premium, and we answer no to get a preferred premium. Currently today, till the end of August, there's a couple of options that you have available. The option we recommend is this 12-month term. This is one application, 2 policies. We have the application policy, let's say, goes in effect tomorrow. It's good, policy is good for a year, and then it rewrites itself for an additional year. In the center box, I can also select a 24-month coverage. And this is where it gets a little confusing sometimes with our plans. Here I can choose a 12-month, which is 24 months of coverage. And here I can come in and select 24 months of coverage. The difference is this: if you select a 2x12, that is one application, 2 policies. If you select a straight 24 months, it is one application, 1 policy. And it really makes a difference when you start looking at things like this. In a 2x12, which is what's selected here, in a 2x12, you have the enhanced